Welcome to Asthma Concept Map from Zoom Out Pharmacotherapy. In this video, you will learn how to read the map and what information you can get from it. This map consists of asthma definition, epidemiology, etiology, pathophysiology, classification, signs and symptoms, diagnosis, treatment, patient education, follow-up, and asthma in pregnancy. Now, let's begin with the definition. Asthma is a chronic inflammatory disease of airways. It's characterized by increased responsiveness of the tracheobronchial tree to various stimuli. This part of the definition briefly mentions the pathophysiology and triggers of asthma. The rest of the definition describes asthma signs and symptoms, which are collected in this image, like cough, wheezing, shortness of breath, chest tightness, and so on. Back to the etiology. The development of asthma depends on the genetic susceptibility and the presence of environmental factors. And this is a list of these factors. You have to know that identifying triggers of asthma for a patient and avoiding them is an essential part of managing the case. There are 3 classifications of asthma, and they spread here within the map according to their relevancy with the other parts of the map. The first classification is according to etiology, the second is according to asthma severity, and the third is according to the control, and it's mentioned here after treatment. Diagnosis of asthma depends mainly on history, physical examination, and pulmonary function tests. Regarding history, it's important to figure out the following: course of previous attacks, response to medications, especially the frequency of using beta-2 agonists to control the attacks, triggers, and comorbid conditions, or associated symptoms. Concerning spirometry, it is used for all patients more than 5 years old. And you can find here how it's done, what measurements are used to assess asthma cases, and why it's important. Now comes the treatment part. It's divided up into treatment of chronic asthma and treatment of acute asthma exacerbation. This big table here collects all asthma medications in a very comprehensive way, focusing on the most important characteristic information that is usually needed during practice. Note that pink-colored medications are relievers, and those that are green-colored are controllers. After that, steps of asthma management including preferred and alternate treatments are present in this table. And as mentioned before, classification of asthma according to the control is represented in this table. Finally, you have here patient education, and what self-management education should include. Follow-up, and assessing asthma control, as in the table. And managing asthma in pregnancy. This was an overview for Asthma Concept Map from Zoom Out Pharmacotherapy. It's recommended to watch this video several times. Pause whenever needed to study the details. Then, listen to the video without watching and pause frequently to test yourself. For more about asthma and other diseases, please visit www.zoomout-ph.com.